We got a collapsed patient. She is at the intensive care now. She was treated, but she... well, like I said, she collapsed. Hey guys, welcome to Unmodded Gaming. I'm the Unmodded Gamer, and I'm back with more Project Hospital. And I said I was going to skip the night last episode. I just realized I forgot that. So I'll be right back. And here I am again. So we are having the day shift come in. I hired some guy for the Thomas Allen over here for the radiology to make x-rays at night in case I get any patients by the ambulance, which I just got someone Mary White over here with an open fracture of the humerus. Open fracture, also called compound fracture, is a fracture resulting in an open wound caused by the dislocated bone, often bone protruding through the wound. Humerus is the bone in the upper arm, so that is broken basically, and it's peeking out to the outside, so it's pretty nasty. But what are they doing? Okay, she's undergoing stabilization. I don't know why they are doing that, but she's gonna have to get a surgery for that. And well, we basically just got our first patient from the ambulance. Also tonight we got a collapsed patient. She is at the intensive care now. She was treated, but she... well, like I said, she collapsed. She came from the internal medicine department, and she is now at the artificial ventilation. A procedure to restore or help with respiration by exchange of the gases by the respiratory system. It consists of an endotracheal intubation of the patient and connecting it to the mechanical ventilation. And she had a collapsed lung, which is now suppressed. And by the end of this day, I expect she'll be going back to the internal medicine department. And as you may expect, she came from the medium care. Not many people know that is a thing, but there's actually a medium care in a hospital, and I can show you right here what it is. As you can see, we have a regular ward, and we have this, the HDU, which stands for High Dependency Unit. So that is where people go who are immobile, or who are not really in that much of a state that they need to be hospitalized at the ICU, but their health has been pretty bad, or is pretty bad. So let me just check what this patient is suffering from. Pleurisy, if I pronounced that correctly. It refers to a condition when the membranes surrounding lungs become inflamed. So this person is having an MRI taken, Barbara Wright, and she has an IV antibiotics. Treatment where antibiotics are delivered by the intravenous route in order to increase the effectiveness of the treatment. And she has one hidden symptom actually. Let me see, what is that? Can be bacterial infection detected, which is now suppressed, but it can be seen by doing some sort of a test. PCR testing, it looks like. Well, apparently they didn't find that. Maybe she has tachycardia. No, that can't be. Well, sometimes I just don't get this. There should be, like, a list of symptoms a person can have. This is just a partial list of what you have already discovered. This is a potential list of what can be found. And here you can see that she doesn't have anything that can make her faint, because if that were the case and you'd have discovered it, it would like become bigger and smaller. So swelling joints can be annoying, but it's definitely harmless. I mean, compared to tachycardia, which is elevated heart rate. So when you're in rest, your heart rate should be between 60 and 100 beats per minute. And you have tachycardia when it comes over like, I don't know, 200, 150. But anyway, that is basically what tachycardia is. And as you understand, that is way more severe than joint pain or breathing problems or muscle pain or anything like that. So that is pretty innocent, but when I haven't discovered the symptoms, wait, let me just get it back. Right, here it was. When I haven't discovered a symptom, you see here one hidden symptom. That means I don't have discovered that symptom yet. But when it starts like becoming bigger and smaller, it means at least one of those symptoms could be something that can make her faint, or that can make the patient faint. So in this case, that is not the case. But I'm gonna have to keep a close eye on it, especially when I get patients by the ambulance. I also got a few more things last night. I performed one surgery and I have to treat 30 patients per day. I got 80% prestige at any specialized department, and I got 80% prestige at the emergency at the end of the day. Which reminds me of the patient at intensive care. I forgot to give her some painkillers. Let me just go ahead and do that. And once we have done that, there isn't really much that requires our attention now. I'm not going to extend the hospital yet, because we may have $40,000 in budget, but I don't want to spend it all at once. So I'm going to maybe have a quick look at the emergency department and at the patients that are coming in. Maybe you can find something interesting here. As you can see, it's pretty busy right now. What is this? Malaria? Malaria, also called sweat rash, is a skin disease, common in hot and humid conditions. Malaria. Okay. I thought it said malaria there for a moment, so it had me scared there. But it definitely looks like, since the last time I've played, they've added some things. Like, for example, the condition I was talking about earlier, tachycardia. It can now be discovered by ECG and a heart, I don't know what to call it. Let me see if she... heart monitoring. Right. So an ECG is basically like a small or a short amount of time doing a heart monitoring. Whilst a heart monitoring is just keeping an eye on somebody's heart for an extended period or an extended amount of time. So that is basically the difference between those two. But in the game it said you could only discover if someone had tachycardia by making an ECG. So you could only find out at the emergency department, and maybe at the intensive care also, I believe. I can't remember, but I believe you could do that in patients who were critical. So if someone wasn't critical, you couldn't do an ECG and you couldn't find out if they had tachycardia, even when there was one hidden symptom still like getting bigger and smaller, indicating that the patient could collapse from it at any moment. But I found a way around it, of course. I did heart monitoring for those patients, and it felt kind of like I had hacked the game or something, or I had cheated at the game. Wait, let me see what this is. What? Okay, I can't remember I took over control of this patient, but okay. Well, let's just get her back to the doctor then. She also wasn't in here. What is this? How did that happen? Well, anyway. Right, so... it felt kind of like I had found a hack in the game or a way around the game mechanics. So I thought that was really nice, but now they have added that in, so it doesn't feel special anymore. And now we're just waiting for something to happen. And in the next episode I will probably see if I can open another department. And here we have a patient with cirrhosis. I hope I'm pronouncing that right. It describes a condition where the liver is malfunctioning due to long-term damage. Normal liver tissue is replaced with scar tissue. So it doesn't seem too bad. Weakness, fever. What is this? Jaundice? Also known as icterus, is a yellowish pigmentation of the skin and eyes due to high bilirubin levels. Okay. What are antipyretics? Drugs used to lower the temperature due to fever. Okay. And I also like to do like a checkup on every patient that is here every night. So I've done that off camera, but I've checked to see if everyone had a diagnosis and if everyone was treated and weren't going to collapse at any moment. And now that we're talking about that, let me just have a look at the general surgery department, which doesn't seem very popular yet. We only have one patient there with some sort of an infection. Helicobacter pylori is a bacteria present in the upper gastrointestinal tract. It is the main cause of peptic ulcers. And I don't know what that is, but that patient is getting some treatment for it. Let's have another look at the patients at the emergency department. We have someone with either otosclerosis, referred to abnormal hardening of the bone tissue near the middle ear, causing inability to transfer sounds from the middle ear to the inner ear, resulting in loss of hearing. Kate Brown could also be having a concussion or a cerebral confusion. I don't know what that is, but it's a traumatic brain injury, usually due to blunt head trauma. And the concussion is a mild traumatic brain injury, resulting in temporary altered mental state and or loss of function. And as I had expected, the ICU hospitalization has finished, and like I said before, I like to take control over those patients, so I'm going to give her back to the doctors. And she's now going back to the internal medicine department where she came from. When I got her, it sounded all like there was something really bad going on with her, but actually it turned out to not be that bad. But this is enough for today's episode, so I'm going to end it here, which means I'm going to say subscribe for more. Thanks for watching, and as always, stay unmodded.